A doctor stands in his laboratory, surrounded by rows of glass jars. Inside each jar floats a human brain, preserved in formaldehyde, labeled with the patient's name and the date they died. By 1932, Dr. Harvey Cushing had collected over 2,200 brains, creating the largest collection of human brain specimens in medical history. He photographed his patients before surgery, during their operations, and after they died. He kept their tumor samples, their X-rays, and their brains, all in the name of science. But the question remains, did these patients truly consent to becoming permanent exhibits in a neurosurgeon's private museum? Harvey Williams Cushing was born in 1869 in Cleveland, Ohio, into a family where medicine was already a tradition. His father was a physician, and young Harvey seemed destined to follow the same path. He attended Yale University and later Harvard Medical School, but it was at Johns Hopkins Hospital in Baltimore where he would begin the work that would make him the most famous neurosurgeon in the world. The year 1902 marked a turning point in Cushing's career and in the history of brain surgery. During one of his early operations to remove a pituitary tumor, something went wrong. The specimen he had carefully extracted somehow went missing, leaving him with no physical evidence of the tumor he had removed from his patient's brain. This incident frustrated Cushing so deeply that he made a decision that would define the rest of his career. He would never lose another specimen again. From that moment forward, Cushing began keeping every brain tumor he removed. But he didn't stop there. He started documenting each case with meticulous detail, taking photographs of patients before surgery, during the operation, and sometimes after death. He preserved not just the tumors, but often entire brain sections, creating detailed records that included microscopic slides, patient histories, and surgical notes. The collection grew rapidly as Cushing's reputation spread, and more patients sought his expertise. Brain surgery in the early 1900s was essentially a death sentence. Most surgeons wouldn't even attempt operations on the brain because the mortality rate was so high. Cushing changed that by developing new techniques that dramatically improved patient survival rates. He introduced the use of local anesthesia instead of general anesthesia for many procedures, allowing patients to remain conscious so he could monitor their brain function during surgery. Cushing also pioneered the systematic monitoring of blood pressure during operations, recognizing that maintaining stable circulation was crucial for brain surgery success. He was among the first surgeons to use X-rays routinely for diagnostic purposes, helping him locate tumors before making incisions. These innovations made him the most sought-after brain surgeon of his era, and with each successful operation came another specimen for his growing collection. The visual documentation Cushing created alongside his physical specimens was unprecedented in medical history. He photographed patients from multiple angles, capturing not just their medical conditions, but their humanity. These portraits are haunting in their intimacy, showing people in their most vulnerable moments, often just days or hours before death. Cushing believed that seeing the faces behind the medical conditions would help future doctors understand the human cost of neurological disease. During World War I, Cushing served as a military surgeon, where he developed new techniques for removing shrapnel from soldiers' brains. He invented a surgical magnet specifically designed to extract metal fragments from brain tissue, saving countless lives on the battlefield. The war gave him exposure to types of brain injuries he had never seen in civilian practice, and naturally, he documented these cases as well, adding to his ever-growing archive of human brain specimens. By the 1920s, Cushing's collection had become legendary within the medical community. Fellow physicians would travel from around the world to study his specimens and learn from his cases. The collection contained examples of virtually every type of brain tumor known to medical science, along with detailed documentation of surgical techniques and patient outcomes. For medical students and practicing neurosurgeons, it was an invaluable resource that existed nowhere else in the world. Cushing's meticulous record-keeping revealed patterns in brain disease that had never been recognized before. By comparing hundreds of similar cases, he was able to identify correlations between tumor location, patient symptoms, and surgical outcomes. This data-driven approach to medicine was revolutionary for its time and helped establish neurosurgery as a scientific discipline rather than a desperate last resort. In 1912, Cushing made one of his most significant medical discoveries when he identified a condition that would later bear his name: Cushing's disease. This hormonal disorder, caused by tumors affecting the pituitary gland, had previously been misunderstood and often misdiagnosed. Cushing's detailed documentation of cases, including preserved brain specimens and patient photographs, provided the evidence needed to establish this as a distinct medical condition. The ethical questions surrounding Cushing's collection become more complex when examining how he obtained consent from his patients. Medical ethics in the early 1900s were vastly different from today's standards. Informed consent, as we understand it, simply didn't exist. Patients rarely questioned their doctor's decisions, and the concept of patient rights was virtually unknown. Most people were simply grateful that someone was willing to attempt surgery on their brain tumors, regardless of what happened to their remains afterward. If you want to understand how medical ethics have evolved and why modern standards exist to protect patients, make sure to subscribe because we explore the dark history of medical experimentation and the fight for patient rights throughout history. Records suggest that Cushing did obtain some form of consent from many patients or their families, but the nature and extent of this consent varied greatly. Some patients explicitly agreed to post-mortem examination and specimen retention, understanding that their cases might help future patients. Others may have given only general consent to medical procedures without fully understanding what would happen to their remains. The documentation from this era is incomplete, leaving many questions unanswered about whether all of Cushing's specimens were ethically obtained. The power dynamic between doctor and patient in Cushing's era was also vastly different from today. Patients facing terminal brain tumors had few options, and Cushing was often their only hope for survival. This desperate situation may have influenced patients' willingness to agree to his requests, raising questions about whether true informed consent was possible under such circumstances. When Cushing retired from Harvard in 1932, he faced a decision about what to do with his massive collection. Rather than donating it to Harvard, where he had spent most of his career, he chose to move the entire archive to Yale University, his alma mater. The decision caused controversy within the medical community, as many believed the collection should remain at Harvard, where it had been created. The move to Yale required careful planning and execution. Each of the thousands of specimens had to be carefully packed and transported, along with the corresponding documentation, photographs, and microscopic slides. The collection filled an entire laboratory at Yale, where it continued to serve as a research and teaching resource. When Cushing died in 1939, Yale inherited not just his brain collection, but also his extensive library and research materials. For decades after Cushing's death, his collection remained primarily a resource for medical professionals and researchers. Access was restricted to qualified scientists and students, and the general public rarely saw the specimens. The brains continued to serve their intended purpose of advancing medical knowledge, contributing to research on brain tumors, surgical techniques, and neurological conditions. The ethical landscape began shifting in the latter half of the 20th century as society developed new perspectives on human dignity, patient rights, and the display of human remains. Museums around the world started questioning whether they had the right to exhibit human bodies and body parts, even for educational purposes. These changing attitudes inevitably reached Cushing's brain collection. In 2010, Yale opened the Cushing Center, creating a dedicated space for displaying selected specimens from the collection. The center was designed with careful attention to ethical considerations, presenting the brains not as curiosities, but as part of the history of medical progress. The exhibits emphasize the human stories behind the specimens, including information about the patients whose brains are on display. The Cushing Center's approach to exhibiting human remains reflects modern ethical standards while still serving educational purposes. Visitors are reminded that each specimen represents a real person who suffered from neurological disease and chose to undergo experimental surgery. The displays include contextual information about the era's medical practices and the evolution of brain surgery techniques. However, the center's opening reignited debates about the ethics of displaying human remains. Critics argued that no matter how respectfully presented, exhibiting human brains without explicit consent from the deceased violated basic principles of human dignity. Supporters countered that the educational value of the collection, particularly for training future neurosurgeons, justified its continued display. The debate over Cushing's collection reflects broader questions about medical museums and the display of human remains. Should historical medical collections be treated differently from contemporary specimens? How do we balance educational value against individual dignity? These questions have no easy answers, and different institutions have reached different conclusions. Modern medical practice has incorporated strict ethical guidelines for specimen collection and retention. Today's patients receive detailed, informed consent documents explaining exactly what will happen to any tissue removed during surgery. Institutional review boards oversee research involving human specimens, ensuring that proper consent has been obtained and that specimens are used appropriately. The contrast between Cushing's era and today's standards illustrates how dramatically medical ethics have evolved. What was considered normal and even admirable in 1902 would be completely unacceptable in modern medicine. This evolution reflects society's growing recognition of patient autonomy and the fundamental right to control what happens to one's own body, even after death. Cushing's legacy in neurosurgery remains undeniable. His techniques saved thousands of lives and established brain surgery as a legitimate medical specialty. The detailed records he kept advanced scientific understanding of neurological conditions and surgical outcomes. Many of the innovations he developed are still used in modified forms today. The brain collection also continues to serve research purposes, though in ways Cushing never imagined. Modern scientists can use advanced techniques to analyze the preserved specimens, potentially discovering new information about brain diseases and their treatments. Some researchers have used the collection to study the historical evolution of brain tumors and surgical techniques. The photographs Cushing took of his patients have become valuable historical documents, providing insight into not just medical conditions, but also the social and cultural context of early 20th century healthcare. These images show how patients and families coped with devastating diagnoses in an era when treatment options were limited and survival rates were low. The Cushing collection has also influenced how other medical museums approach the display of human remains. Many institutions have adopted similar strategies of emphasizing historical context and human dignity while still preserving the educational value of their collections. The ongoing discussions about the collection have contributed to the development of best practices for medical museums worldwide. Today, Harvey Cushing's brain collection remains at Yale, carefully preserved in climate-controlled storage. Most of the specimens are no longer on public display, accessed only by researchers with specific educational or scientific purposes. The debates over the collection's ethics continue, reflecting society's ongoing struggle to balance scientific advancement with human dignity. But perhaps the most unsettling aspect of Cushing's legacy isn't what he collected, but what his methods reveal about the power dynamics between doctors and patients that still exist today. The question isn't just whether those patients consented to become permanent specimens. The question is whether they truly had a choice.